rheumatologist perception about biosimilars. Dr. Triki, you have 10 minutes for your presentation.
Good morning. Today, let me present you our study titled Rheumatologist Perception of Biosimilar Medicines in Tunisia. Biosimilar have been introduced into the therapeutic arsenal for treatment of chronic inflammatory rheumatism. They are available in our country since February 2018. Despite solid studies and a valid interchangeability strategy, it remains at the margin. The aim of our study was to assess the knowledge, opinion, and experience of Tunisian rheumatologists with regard to biosimilar medicines. A web-based self-administered survey was conducted among Tunisian rheumatologists during the month of March 2018. Participating physicians represented various geographic locations throughout Tunisia. We a total of 54 rheumatologists responded to the survey. Among all responders, 20 were hospital-based rheumatologists, 14 were office-based rheumatologists, 5 were health doctors, and 15 were residents. More than half of responders, 54%, were in favor of introducing biosimilar. When asked about the reason of showing negative opinion regarding biosimilar, 57% showed fear about less efficacy than their reference biologics. 38% believed biosimilar had less safety than their reference biologics. 15% thought there were no meaningful difference between the biosimilar and the original drug in terms of economy. 11% were concerned about higher risk of immunogenicity, and 3% because of lack of legislation. About 80% of rheumatologists would not consider a biosimilar switch if patients were previously treated with reference biologic and are good responders. Only 4% would consider a biosimilar switch. Only 4% would start a treatment with biosimilar in biologic treatment-naive patients, and 60% of responders needed proofs of efficacy and safety before considering that. Fifth of responders felt very well informed about interchangeability strategy. 50% felt moderately informed, and 29% were not informed at all. Hospital-based rheumatologists were significantly better informed about interchangeability than other physicians. Comparing our results to those in France and in America, we found two interesting articles recently published. Our findings were comparable to these articles in terms of ratios of hospital-based and office-based rheumatologists. Although our concerns targeted more efficacy than safety of biosimilar, the French and the American rheumatologists were concerned about both safety and efficacy equally. French and American rheumatologists are more likely to consider a biosimilar switch if patients were previously treated with reference biologic and are good responders. American rheumatologists were more informed about interchangeability strategy with 51%, followed by French rheumatologists, then Tunisian rheumatologists. In Tunisia, many rheumatologists are not in favor of introducing biosimilar because of skepticism, weakness about quality, safety, and efficacy. Numerous physicians still moderately are not informed about a lot of points, especially about interchangeability strategies, which could be explained by the very recent introduction of biosimilar. How to proceed for a better perception? Targeted communication initiatives, additional experience in biosimilar drug prescription, availability of more clinical data, no systematic interchangeability according to FDA's guidelines, and implication of Tunisian health insurance physician. To conclude, further work is needed to enhance understanding and to overcome misperceptions relative to biosimilar medicines among rheumatologists. Targeted communication initiatives, additional experience in biosimilar drug prescription, and availability of new clinical data may help to address these concerns. Thank you.
Thank you.